flight. I did my group with Lexi Hilbert and David He. So what is lissencephaly? Lissencephaly means smooth brain. So it is a congenital defect which means it's present from birth. It's an extremely rare disorder that occurs only in 1 in 100,000 births. In a brain with lissencephaly, there is lack of development in the sulci and gyri, which is the normal grooves of the brain. So here you can see the lissencephaly brain is on the right and the normal brain is on the left. So pathophysiology, as I said, about 1 in 100,000 babies are born with lissencephaly. It's caused by mutated genes, so it can appear randomly with no family history. It can be from a uterine infection within the pregnancy. Possible for a baby in a womb to have a stroke that then leads to it, but generally it occurs within the 12th to 14th week of gestation when in a normal brain the neurons move around the brain. But with lissencephaly, that doesn't happen. So symptoms, these begin after birth. So difficulty swallowing, difficulty feeding, seizures, muscle spasms, severe developmental delays, malformed toes, fingers, or hands, psychomotor impairment, and failure to thrive. So here you can see some pictures of some children with lissencephaly and what their brains look like. There are different stages and different amounts that it can happen. So diagnosis, doctors will use a brain scan to diagnose it. So here you can see a normal brain scan and a brain scan with lissencephaly, a CAT scan, MRI, or EEG. And there's also genetic testing if it is a genetic disorder, because there is a type that does come from genes. It's a chromosomal analysis with specific gene mutational analysis as well. So treatment, there is no cure for this, so it's generally supportive care, which includes feeding tubes, seizure control medication, shunts to control any hydrocephalus, which is fluid in the brain and spinal cord. But generally it is just supportive care, so as symptoms arise, they will treat those. Prognosis. So the outlook of a child with lissencephaly, it depends on the severity of the diagnosis. Some children don't develop past 3 to 4 months of age, mentally and physically. The average life expectancy is 10 years. Causes of death are often secondary problems such as choking, aspiration, pneumonia, or severe seizures. Here is Maya. She is my best friend's little sister. I did get permission from her family to post this. She is 13, so she is doing really well. She has severe seizures occasionally. She has had pneumonia. Her vision is not great, but she is generally a very happy girl. So it definitely depends on the severity of the lissencephaly. So that's all I have for you.